Hey babes, welcome back to my channel. To those of you who are new here, I'm Ashil, and on this channel we speak everything nursing, beauty, fashion and life. Now I feel like I've been neglecting the nursing part of my channel. I always neglect my nurses. I always neglect my career on my channel, so I'm definitely going to try to bring this back now that I have a little more free time. There has been something that I have been really trying to incorporate in my social media platform, which is talking about conditions that are prevalent in women, mainly women. I definitely will touch on the men as well, but my largest following is female based, so I will be zoning in more on conditions that affect women. I did, for those of you who followed me on my business page when I was in St. Lucia, my makeup page, you would know that I started doing that series and life happened. So I definitely want to bring that back to my social media platform, YouTube, Instagram, TikTok, and definitely try to reach a wide audience as much as possible. I will be naming the series Makeup and Medicine. And like I said, it's just us doing makeup and delving into a condition. I will try to do one condition every week. I'm not sure how it will go. Can't promise anything. But I decided to start off this makeup and medicine series with fibroids, just because we are in July, which is the month of fibroid awareness, and this is something that is very prevalent in especially the black community. And I just felt like it would be a good starter for this series. And yeah, so do stay tuned. Hope you enjoy the makeup. Just so I could focus on makeup, I will be doing a voiceover from here on, but hope you enjoy both the information that you get and you commit it to memory, write it down, look for the signs, ensure that you know what's going on with your body, ensure that you know when to seek medical care, ensure that you are just aware of what's happening in your body. And yes, I am a medical professional, but I may miss out on some things. So if you do know of any other thing that I probably missed out in this video and for future reference, feel free to leave it down in the comments below. Let's have a discussion. Let's talk about the things that affect us as women, and let's go. As I stated, July marks Fibroids Awareness Month, a crucial time to raise understanding about a common yet often misunderstood health condition affecting many individuals, particularly women. Fibroids, which are also known as uterine fibroids or the medical term leiomyomas, are non-cancerous growths that develop in the uterus. While often benign, these growths can vary significantly in size, number, and location, influencing symptoms and treatment options. So, of course, depending on the size, how many of them there are, and where exactly they're located, that can determine what symptoms you receive or you experience, or the treatment options that are available to you. So let's look at the causes. Fibroids originate from smooth muscle tissues of the uterus, developing into firm, rubbery growths. The exact cause of fibroids remains unclear, although genetic factors such as hormonal influences, especially estrogen and progesterone, which of course are hormones, and certain lifestyle choices, for example, probably the foods that we choose to indulge in, may contribute to their formation. These growths can range from microscopic or very small, minute, to several inches in diameter. and a woman may have one or multiple fibroids simultaneously. Let's look at the symptoms. So, the presence and the severity of symptoms associated with fibroids can vary widely. Some individuals may experience no symptoms at all. However, some may encounter heavy menstrual bleeding, so you would have prolonged or heavy periods, sometimes leading to anemia. And of course, anemia is a low blood count because, of course, if you're losing a large amount of blood every period, then you're not replacing that blood adequately or in a timely fashion, which leads to anemia. Another symptom is pelvic pain and pressure. So the fibroids can cause a discomfort or pelvic cramping, which pretty much feels like severe period pains or period cramps, and a sensation of heaviness in the pelvic area. They may also cause urinary symptoms, such as increased frequency, and by that I mean having to urinate quite often. They may also cause urinary urgency. So you're rushing to use the washroom. By that time, you probably have an accident or something because of the pressure that the fibroid is causing on your pelvis. And of course, sometimes difficulty urinating, where you may have to sit on the toilet for a while before anything comes out because of the fibroids compressing the bladder. You may also experience reproductive issues such as infertility or difficulty conceiving or having a baby, in other words, and this may result because of the fibroid's location within the uterus. So, these are just signs and symptoms to be wary of. The risk factors or things that can lead to the formation of fibroids would be age and gender. So, fibroids are actually most common during the reproductive years, and that is typically between the ages of 30 and 50. And it is pretty much rare before puberty and after menopause. Another risk factor can be family history, where individuals with a family history of fibroids are at a higher risk. So, if you have persons who are in your family who have experienced fibroids or are suffering from fibroids, you may have a higher likelihood of developing the fibroids. Ethnicity. So, African American women are more likely to develop fibroids more frequently and may experience more severe symptoms. So just because of your race or your ethnicity, you probably just have that increased likelihood of the severity of the symptoms that you experience with the fibroids. And of course, hormonal factors, like I said previously, which are estrogen and progesterone, two hormones which promote the growth of the uterine lining during the menstrual cycle. And of course, they also appear to promote the growth of the fibroids. Let's move on to the diagnosis and treatment of fibroids. They are usually diagnosed using either a pelvic exam, an ultrasound, MRI, or any other imaging techniques to visualize the uterus and detect any growths. Now, the pelvic exam is pretty much a physical examination which is conducted by a healthcare provider to assess the organs within the pelvis. That includes the uterus, ovaries, and cervix. It typically involves inspecting and palpating these organs through the vagina or the abdomen, and it helps in diagnosing issues such as infections, tumors, or abnormalities in the reproductive organs. The ultrasound, however, is an imaging technique which uses high frequency sound waves to create pictures of inside the body. For pelvic concerns, a pelvic ultrasound can help visualize structures like the uterus and ovaries, and can be done transabdominally, which is through the abdominal wall. I did not pronounce that word properly. I said transabdominally. So transabdominally, so through the abdominal wall, or transvaginally, which is using a probe that is inserted into the vagina to visualize the organs. And it's commonly used to detect cysts, fibroids, of course, and any other abnormalities within that area. And the MRI, which stands for magnetic resonance imaging, pretty much uses strong magnetic fields and radio waves to produce detailed images of organs and tissues inside the body. So it's particularly used for getting detailed images of soft tissues and often used when more information is needed after an ultrasound or pelvic exam does not show enough. It can help in evaluating complex conditions such as tumors or detailed anatomy of the pelvic structures. Now, as I said earlier, your treatment would be dependent on the size of the fibroid, where exactly it's located, and of course, the severity of your symptoms. So, first, they would have watchful waiting, which pretty much is observing those fibroids, especially if they are small and you are asymptomatic, meaning that you do not have any symptoms. That would pretty much entail monitoring their growth without any intervention at the time. Of course, you would need to have medications on board if they require that. So you would have your hormonal treatments such as birth control pills, and these can help manage symptoms by shrinking the fibroids or reducing the menstrual bleeding. Non-invasive procedures are also an option, and one example of that would be the uterine artery embolization, or UAE, or MRI guided focused ultrasound surgery, which pretty much offers alternatives to surgery by targeting and shrinking the fibroids. So with the UAE, a small incision is made in the groin region, or sometimes even the wrist, and a catheter is inserted into a blood vessel. The catheter is guided through the arteries to reach the uterine arteries. Once the catheter is in place, tiny particles, which are embolic agents, are injected into the uterine arteries. These particles block the blood flow to the fibroids or any affected region, which causes them to shrink over time due to a lack of the blood supply. With the MRI guided focused ultrasound surgery, there is a device called a transducer which is placed on the skin. This pretty much emits high intensity ultrasound waves which are focused on a precise point, which of course is the fibroid. The focused ultrasound waves generate intense heat at that targeted area, which causes thermal ablation, which is just a fancy word for destruction of the tissue, without harming any of the surrounding tissues. So that would be like a direct impact on the fibroids and sparing any of the surrounding areas. And of course, you would have your surgical options, which would be a myomectomy, which is the removal of the fibroids while preserving the uterus. So you just move the fibroids from the uterus while leaving that in place and untouched. This is an ideal option for women who still want to conceive, of course. And in more severe cases, a hysterectomy, which removes the uterus entirely, that may be necessary.
Okay guys, so this is the finished look. I decided to do a green eye teal into the greenish region just because I know fibroids and cervical health is represented by the teal turquoise kind of color, so I opted to go with that green eye. I have not done a cut crease in years. At least 2.5 to 3 years I have not done a cut crease. So I was super nervous about that, but I did want to step out of my comfort zone and go back into like my real makeup looks and all of that. If I'm going to give y'all a show, I might as well, you know. But let me know what you think about this series. Please leave comments below. Let me know what you think, especially what you think my next topic should be on. Each month I'm going to try to focus on the condition that is or the conditions rather that are observed in that month, and as well as other conditions that you will let me know that you want me to speak on. Of course, I do appreciate you tuning in, and I appreciate the love and the support and all of the things. Like I said, please let me know what you think about this series, what you think about the makeup. Hello, look at the eyes. So the eyes look like a close-up for the eyes. I don't know how I feel about it, because honestly I don't do shadows. Like if I do shadows, it's very neutral, or it's probably one color or two for the most. But I don't do all of this. This is really out of my comfort zone. Even when I did it before, it was out of my comfort zone. But like I said, I did want to incorporate a little of the awareness color in there, and just to get a full gist of what we're speaking on. So guys, please take my advice, do more research on the topic of fibroids, get your yearly physicals done, and please just remember that God is the great healer, the great physician, the Alpha, the Omega, and there's nothing that he cannot fix. There's nothing that he cannot heal. There's no condition that is too big or too small for him to do away with completely. So this is me logging out, saying thanks for tuning in. And I hope to see you in the next one. Please don't forget to like, subscribe, and share this video, because we need to spread awareness about the conditions that we go through, and we need other females, other women, other ladies around to be aware of their bodies and what to look for, etc. So see you in the next one.